Thank you. Thanks. This is great. I love that you just kind of took us right to the spiritual aspect of this, because that's what this is, I believe, for me. I mean, I think we're just so blessed to do this work, and it's a calling. We're fortunate. I'm going to get into some real pragmatic aspects of the arts. This is what we've been doing for the last day, but let's just remember we're better people with the arts and culture in our lives, right? Yeah, absolutely. Yes. Oh, I love this. All right, getting good. Gotta loosen it up here. You know what? I mean, we're more creative. We're more engaged in our community. We feel better about our today. We feel more optimistic about our tomorrows. The arts really touch us deeply and are just part of what it means to be a human being in this world. And boy, you just heard it back to the old part of the brain. It's funny, we're going to hit on a couple of these topics that we've gone so far. But again, just reminding us, before we dive into some of these more pragmatic aspects of the arts, they bring us joy, right? And here's some numbers from our new public opinion survey. And I hope you all got a chance to meet my colleague, Jenna, who's right there. Yay, all right, Americans for the Arts colleague. Thank you. So we're both so proud to be here today. And this timed out so well, because probably week after next, we're releasing a new big public opinion survey on the arts, a national survey, one of the largest of its kind ever conducted. We work with Ipsos, which is the third largest survey research firm in the world. And massive size, too. We do 3,060 interviews. We see all this polling data now. That's based on 400, 600, 1,000. This stuff is airtight, rock solid. But, and so we want to know, right? What are people's opinions about the arts? How much do they participate? What do they feel about government funding of the arts? And what are their opinions? What do the arts mean to them personally? So I'm going to kind of pull out a few of these. So you're getting advanced look here, right? So it's coming up. But, 71%, arts give me pure pleasure to participate in. Right? Isn't that's just the joyfulness. It's just taking us somewhere. They lift me up beyond everyday experiences. Arts, 4 out of 5 people, positive experience in a troubled world. It's challenging times, right? So here we are, the arts just helping us be resilient in this world. And even right here locally, MK mentioned the Arts and Economic Prosperity 6 study, which Greater St. Louis was a part of. Again, thank you, everybody. You know what? This is what's the 6th one, obviously. We did the first one in 1994. Y'all were part of the very first one of 33 communities back in 1994. We had 373 communities this time. So we've been great partners for a long time, Americans for the Arts and RAC. We can talk, we're not really talking much about the economic impact data today. $869 million industry, 12,000 jobs, $155 million in government revenue. We can talk about that after or come back and do another speech. But we added some social impact questions. Look what the arts mean to people in this community. This is based on 1,974 audience intercept surveys that took place in 22 and 23. Massive data set. People really appreciate the arts at a deep level here. 4 out of 5 people say arts are a pillar of our community. Slightly more say, arts and culture, it's part of our community identity. It builds pride. We've got pride in our community because of arts and culture. And a similar percentage, almost 9 out of 10 said, I'd feel a sense of loss if this opportunity was no longer available. And one of the things I think is so fascinating, the last question, 86% said, it's important to me that this cultural venue, this arts and culture event, be available for future generations. What that tells me is that, the arts experiences, they're not these one-time transactional moments, right? Arts and culture is our story, everybody, and it's the story of our community, where we've been, where we are, and where we're going. And the public here really Well, it speaks to them. And those numbers, by the way, are good, 6 to 10% higher than the national averages. So strong arts community here. So arts have been central to our lives for a long time. And I give you as evidence of this, this hand-carved flute. And this flute was actually found by some anthropologists in a cave in Germany a few years back. Now, these anthropologists were studying cave dwellings, civilizations, and, and they thought, boy, wouldn't it be great if we found a bowl or a spoon or hit the jackpot with a cave painting? They came across this hand-carved flute, which they have carbon dated to be 35,000 years old. And it's a beautiful aesthetic piece all on its own. Eventually someone, it's like, well, we should blow some air through it and see what happens. Here, you do it. And, it had some good tonality to it. And this was a big find. This was published in the journal Nature, which is, really one of the top scientific journals in the world. But what was fascinating is these anthropologists were trying to figure out, now, what was the purpose of this flute? They thought, well, maybe it was to help promote territorial expansion. All right, sure. Or a way to celebrate the fertility, rituals or something, or, get back and celebrate the hunt. I kept thinking, maybe they liked the way it sounded. Yeah. That never showed up. But you know what? Arts culture been central to our humanity, for a long, long time. Now, this flute thing really stayed with folks. So fast forward to the Middle Ages, 1400s, 1500s, where we find the shame flute. Now, this little ditty was made out of cast iron, yay, the Iron Age. Let's come up with some insane inventions. The purpose of the shame flute was to punish bad musicians. Yeah, so that round part was clasped around a person's neck and the fingers were shackled to that long iron tube. And if you got a gig at the Prince's Palace and stank up the joint, well, they'd march you around town for a couple of days in the shame flute, so everybody could laugh at the bad musician. And, and it was for a lot of artists. If you were a juggler, I'm a juggler, you drop a couple balls too many, it's like, line them up, so... Now, if we were talking about economic impact today, we'd be talking about cultural tourism and, how people travel for the arts. Look at the crowd. Nothing brings out a crowd like the shame flute, right? So anyway, I like to think we've come a long way since then. The arts are part of our lives. We seek out arts experiences. And so now we're back to my public opinion survey here. And 79% of the American public said, yeah, in the last year, I went to an arts or culture event. And, we gave people a dozen options. And because if you just say, we know as a researcher, hey, last year, did you go to an arts event or did you do it? No, I didn't do that. But then when you say, well, did you, go to a museum? Did you see the theater? Did you have a concert or something like that? Oh, yeah, check. So it means you got to buy 13 questions instead of just one easy one. But 4 in 5 American adults said, yeah, in the previous year, I attended an arts event. And again, that's pretty steady figure. What's fascinating, though, is we also asked those attendees right after that question, another question, which was, there's a lot of places in the community to have an arts experience. In the last year, did you have an arts experience that you can recall at the airport, or symphony in the park, or in the hospital? 73% said, yeah, I had one of those, and we gave them a list of things as well. And so almost as many people who have gone out and experienced the arts have also had kind of these arts collisions, if you will, in their communities. And 7% of the respondents had an experience in a hospital. And you figure about 10% of the population was admitted to a hospital. This is 2 years ago data. A large percentage of the people who are going into the hospital are having arts experiences. And I think this is one of the things, we can really be thinking about is how do we create more of these community interactions with the arts? And I tell you, that the last presentation got me thinking so much about like versus want, and then the learning and everything. The socialization research that the NEA funded back in the 80s, there was a lot of reports where what they found is that every time people, or most time people have an arts experience, you come out a little bit changed, whether it's a film or a play or a musical piece. Maybe you just have a little more empathy. You see the world or an issue a little bit differently. And the more of those that we have, the more of those that we want. And it's a way of building demand. So one of these days when somebody gives me my stack and says, let's go, increase access and, participation in the arts, my thing will be, how do we make the arts unavoidable in our communities? And I think that's something that we can be thinking about, because people have these interactions all across their community, whether it's in schools or health or public, and in the public spaces or airports, and there's a whole list of things. And it's making these little fractional improvements every time. And we just got a lesson sort of with some brain physiology on maybe why that is. So I think that's a really a cool finding there. We will find a way to experience the arts. So there's been several references to the pandemic, and I'm always just so glad when I come to a community and yay, we're still here, it was rough, right? And we should acknowledge each other for having come through this. Really just give each other a hand, because and that's appropriate. Yeah, absolutely. Clap for yourself, for your neighbor, because the pandemic was absolutely devastating for the arts. It created the worst environment for arts and culture in this country in generations. We all felt it, but the nice thing is every now and then the research comes around the bend. It's like, oh my gosh, yeah, that's it. 99% of arts and culture organizations had to cancel performances or events, suspend operations, close indefinitely. Some of them, never reopened. Johns Hopkins University actually tracks employment at all nonprofits in the United States. It's about 1.6 million nonprofits of all kinds in the United States. 110,000 of them are arts nonprofits. Arts nonprofits lost jobs at 5 times the rate of all nonprofits. We heard it, right? First to close, last to reopen. That was our industry. The Bureau of Economic Analysis, top economics shop on the planet, finally did their big study of the impact of the pandemic on the economy. And we all heard about tourism and airlines and lodging, got hit. But they called out the arts, and especially the performing arts, as among the most devastated industries. Now, we're open again. That's great. Have the jobs come back? Not really. So if you're, this has been so great just to sort of be somewhere else, and hopefully, we're able to put the phones down and experience the moment, because we're doing the work. Now we're just doing it with less staff than even before the pandemic. And let's face it, some of us were a little tired back then as well. Not every arrow, though, was pointed downward for the arts during the pandemic. There was one that was crazy upwards, and that was personal participation in the arts. People making art. 37% of the American adult population said, yeah, I tried some kind of new arts, craft, or creative, expressive art form during the pandemic. So more than 1 in 3. Amazon was writing these articles about this mysterious spike in ukulele sales. What's going on there? And of course, the industry research has shown a 300% growth during those years in ukulele sales. Really, how many loaves of sourdough bread did we eat during the pandemic? I ate them all, just to be a good neighbor. But, did anyone try anything new during the pandemic? Any kind of new art form? Yeah? Anyone want to volunteer what it was? Maybe no. All right, let me just hear one or two real quick. Bought the ukulele! Thank you. People, that's awesome. Yeah. Nice. Pottery. Yeah. Jenna. Right, great, fabulous hair. So I actually I took up knitting. You know, I never really thought of myself as a textile artist, but I guess I could say that. I'm not very good. You know, I make the world's longest scarves, but you know what? I always loved the clickety-clack of the needles. My aunts, my grandmother, they always knit. You know, wherever they were knitting, boy, that was the best conversation in the house too, right? So, you know, we all remember that. But I got to tell you, you can't do your art form, your craft, you can't play your music or culinary or whatever it is, and also worry about, like, am I going to have a job on the other side of this pandemic? Is there going to be an Americans for the Arts or an Arts, or how long are we going to be closed? It just provided just that emotional, spiritual relief, you know, that was really helpful to me, and I think to everybody. In fact, the research shows, because we were part of a big international research study. It's the Epi Arts Project, which is another one of the research labs. You heard about one of them yesterday in Colorado, and so University of Florida, University of College London, we looked at tens of thousands of people who sent us these online survey responses every week. Thank you, wherever you are. And what we found, short story, people who did 30 minutes a day, just some kind of arts, creative, expressive experience. It could be culinary, it could be gardening, it could be, you know, all the different ways we experience arts and culture. Just 30 minutes a day, lower rates of depression, lower rates of anxiety, higher rates of life satisfaction. We saw loneliness and isolation decrease as well. This was an issue, you know, and we heard a little bit about this, you know, over the last 4 hours here, last 2 days, but the Surgeon General came out with a report saying, you know, we have got a national crisis. We've got a loneliness epidemic in this country. And we were headed that way. And, you know, then the pandemic just knocked it out of the park. You know, mental health issues tripled during the pandemic in this country. Hey, one upside of the pandemic is it's okay to talk about our mental health issues now, you know, and that did change the conversation. But like, what are the impacts on our lives of loneliness, for example? It's the equivalent of smoking 15 cigarettes a day, you know, for example. There's all kinds of research out there. And so, you know, you can just Google that report from the Surgeon General, and we've got it on Americans for the Arts. But the arts, though, really are helping address that issue of loneliness and isolation. It's something that we come together and do together. So I've got an arts background in the theater. Duh, right? You know, so we get that. So, but I also actually have a medical research background. I worked at Stanford University. I worked at Scripps Clinic and Research Foundation. When I worked at Scripps, and this is, you know, a number of years back, but every Tuesday at 3 o'clock, we used to have live chamber music in the lobby. And it was already a beautiful lobby, and, you know, with the beautiful architecture, they turned the fountain down a little bit, and it was amazing. 4 musicians just completely transform the space. But what we started to notice is that patients that we'd see in their rooms clinically, lethargic, depressed, you know, even if you had a view of the ocean and everybody there did, nobody wants to be in the hospital, right? But you could see physical transformation in people. Their eyes got less cloudy. Their posture got better. And it's like you could just sense a greater awareness of the environment around them. And you know, we would notice this as medical staff. You know, it's like something's happening here. You know, it's like they're getting an IV drip of the arts. And of course, now there's this growing body of research, and, you know, we've been hearing about it for the last 2 days, that shows, you know, when the arts are part of our healing, shorter hospital stays, fewer doctor visits, less medication, lower rates of depression, even evidence that it saves money. And I'll give you an example. So, because, we heard it so well, and the good doctor just left us, but that was a great presentation yesterday. We were hearing about ROI and the cost of staff turnover and everything, right? I tell you, in this country, if you want to move policy, boy, you got to try and attach a dollar figure to it, because that's just what gets people's attention first. So there was the hospital in Tallahassee, Florida. And they were dealing with the issue of pediatric CAT scans. And, if you've ever had one of these, even as an adult, it's claustrophobic and they're just very uncomfortable procedures. Kids can have a really high retest rate, right? Because they're squirmy and this and that, so a lot of times they get a little something to relax, or even a general anesthetic, because you got to get the picture. So they decided, is there a better way to do this than having these kids take all this medication? So they tried a music intervention. And about an hour and a half before the procedure, they had a harpist or a guitarist come in, a music therapist, sit with the child, talk, play music. That reduced the stress and anxiety of the environment for the child's parents, because you know how it works. Like, they're looking at mom and dad, and if their parents are freaked out, so are they, right? That worked to the tune of a 98% procedural success rate and saved an average of $567 per procedure on anesthesiology time, nursing time, medicine. I mean, right? What a fabulous win all the way around, right? More opportunities for our artists and our musicians. So some really impactful economic findings that go with that as well. One more data point with this, and I'll give you, it's a prevalence survey. So we partner with the Joint Commission. And the Joint Commission, as you may know, accredits the nation's hospitals and palliative care centers and everywhere else. Just under 50% of our nation's hospitals have some kind of arts programs now. And when, the people doing these surveys responded, it's because big on the list, they aid in the patient's emotional and physical healing. So, again, we're starting to get that understanding out there. So this is how I came to learn about the impact of the arts in the healthcare setting. Let me tell you how I really came to know it. So next month, it'll be 10 years ago, I had open heart surgery. The guy was mostly vegetarian and played soccer twice a week. Doesn't matter, you can't hide, on the table. Quintuple bypass, 4 arteries over 90% blocked. Let me say, I was lucky. I almost had no symptoms. Get checked, everybody. Please get checked. But because I was just a couple months away from being like one of those, God, he seems so healthy, and then face plant on the stairs, right? It's a hell of a surgery. It came up really quick and everything like that. But by the second day, I'd gone up from ICU to the telemetry unit, and every couple hours they're unplugging things, and it's like, here's my body, it's all yours, I remember the second night, though, in the hospital, they put you on these sternal precautions, right? You're not allowed to lift anything up, you can't roll over. And I was in my bed that night, and the sheets and I kind of started sliding down, right? And I was sort of like in the middle of the bed, and there was my little call button up there. I was stuck. I couldn't move. I was like this blob in the middle of the bed for like 2 hours until they came back in, right? So I was finally in a place where they're not checking on me, every 30 minutes. I could have used a check there. But there was that moment, and then the next day, they get you up, they get you walking around, and which is amazing as well. And so there I am, with my chest tubes in this hand and telemetry devices in this hand. And the physical therapist says, hey, listen, we're going to go do one of these stairs things. Like you go up a few stairs, little platform, then you go down, right? We've all seen those. And I'm like, oh, wow, when are we going to do that? And she's like, oh, right now. And you're not going to leave until you can do it. And I'm like, easy. I played a soccer game a week ago. I mean, I got this. And I couldn't do it. I couldn't even do one frickin' step. Tried it with that leg, and I thought maybe it was that leg that was the problem or something. And all of a sudden, it really hit me. This is like, I'm back to zero here. I didn't really realize between like not being able to roll over and push a call button, not be able to walk up one step, and so I had serious doubts, like, is there another side to this? How do you even imagine it? So I started like walking the halls again, and it's just like, I gotta keep moving. And I happened upon a piece of art in the hospital, and they had some art there, and it caught my eye, and it just drew me in, and it was the textures, it was the colors, it was just a feast for the eyes. And so it pulled me in, but what happened after that is just, it's just magic. It's transformative because I could feel the healing hand of the artist, touch me. And I mean, it was as strong as the power of prayer, which I didn't really understand either until all of that. You're in the hospital, your radar dish is like on high sensitivity. It gave me a sense of hope, which I didn't know where I was going to find, and thought, you know what, maybe I can get to the other side of this. And are there artists? There are artists in here, right, that are doing work? Yeah, show of hands, thank you. And the people who enable those artists, the program directors, the funders, all those, you're a part of this. Advocates. Everyone's hand goes up for advocates, right? This is a trick question. We're all champions for arts and healthcare. I just want to thank you because I never got to thank that artist. I don't know who they were. I, never saw the art again or anything like that. So it's so when we talk, MK, you talked about spiritual. That's what this is, and that's it's a lot, but. The arts really are just central to who we are. And so let me give you a couple of numbers again. We'll get back to the public opinion study here. Look at these figures. 60% of the American population said the arts helped me cope during times of mental or emotional distress. 7 in 10 said the arts have a positive effect on my overall health and well-being. Check. That was me, right? And so, I tell this story. It's like the work you do just matters so much. And I'm just so grateful for all of you to be able to, the work you do, and to be here to say thank you. Okay, let's do a couple other things here real quick. MK said like, hey, follow up with any data points that may need something. So we heard Pastor Bethany yesterday talk about singing in the shower. We got a number for that too. The public opinion survey, look at that. 56% of the American population says, yeah, I sing in the shower when nobody else is listening. So, hey, we've got statistics for that too. Here's a similar kind of statistic we did for that. 33% of the population has one or more tattoos. 66% of the population, 2/3, says tattoos are a form of art. Right? Isn't that something? So, I've given you some, we'll hit some policy things and some funding things. These are just great visibility questions. We asked this question a few years ago, and USA Today ran with it on the cover. So, sometimes we just got to ask questions out there that pique people's interest. All right. So I want to now just sort of really briefly expand from the personal well-being, which we've been hearing a lot of, right? The arts also impact community well-being in so many ways: social, educational, economic. And so we've got something, so rather than go through the entire list of things, because time does not permit, this is called our Arts Impact Explorer. I call it the pinwheel, and it's actually the funnest thing in the world, because you just click on any one of these pieces of the pie, and it spins around, and you can see 30 different arts and categories, right? Arts, all the different ways the arts touch our society, our lives as individuals, communities, businesses. And, when you do it in the center will be like, here's a little, snapshot of what does arts and health mean, or what is that? And then, click another button, you get some case studies, and click another button, you get some of the research, and click another button and you get a 4-page, nicely designed takeaway summary of all of those issues. So I just want to make sure that's free. It's on our website, americansforthearts.org/explorer. We're constantly updating it, and it's just a really great tool. But I do want to highlight a couple of the findings. And again, we're back to the public opinion survey here. Arts and culture, our communities are so divided now, yet 72% of the American public says arts and culture create opportunities for shared experiences with people of different age, race, ethnicity, or faith. 63%, the arts help me understand other cultures in my community. Right? I mean, even before the pandemic, we were all trying to, how do we better connect our communities? And, a lot of people would realize, like, wow, the arts, there's these opportunities for shared experiences in public spaces. Here's a couple others. The arts, they help us build empathy and understanding for others. And so, 72% again of the population says the arts create safe places to share ideas, thoughts, passions, even when we have different opinions, and right? So that's one of the things we do, right? We're a place for public discourse where people feel safe to participate. And one of the ones I love, and I'm going to figure out what to do with this. I don't know if I'm excited about that percentage number or not, but 39% of the American adult public said, I changed an opinion or a perception based on my arts experience. That's the power of what we do, right? And so, again, just really interesting. And these are people from the public saying it. Arts education, and it's really one of the most crucial determinants of personal health, community health. And so I just want to hit this one real quick, because I also think it's one of the most important things we can be advocating for. The research is so powerful that students with an education that includes the arts are performing better academically. They have better grades. They have better standardized test scores, lower dropout rates. So let me tell you, there's a great research study, a longitudinal study done by a UCLA researcher named James Catterall. And what he did is he studied national level data on 25,000 students from 1,000 schools across the country. Huge nationally representative data set. And he divided those students into 4 quartiles based on their level of arts involvement. And so, up here, practices violin 3 hours a day, and, down here, maybe got to the museum twice last year or something, and then compared academic performance. And what he found is that the most arts-involved students had this improved and this better academic outputs, right? Better grades, better test scores, lower dropout rates. But now, because we're all good students of research here, a lot of us are probably thinking like, yeah, but, who are those students? Might they not, come from better educated or more affluent families? We'd expect them to do better. So Professor Catterall anticipated that question. And so he went back to his data from 25,000 students, and he looked at just the lowest socioeconomic quartile. So students attending Title I schools, students who live in low-income communities, and he did the same analysis. And what he found, not only did the results hold, there was an even greater disparity between the arts involved and the least involved, the lesser involved students. Helping education researchers think, wow, maybe the arts help level the playing field, or kids who got a late start to catch up. So super powerful research, right? So all students benefit regardless of socioeconomic status. from an education that includes the arts. So put that study over here for a minute, because there's another one that you need to have as context and background, and that's done by the Department of Education. Every 10 years or so, they do a big national look at the provision of arts education, a big thermometer in the ground, and how much arts education's out there. And, nationally, it's, it wiggles a little bit, but it stays kind of steady. Where we see it's really dynamic. Some communities are up and then they're down and all that kind of thing. So, but what they have found is that while it's sort of stayed this way nationally, students of color, students attending those Title I schools, and students in low-income communities have lost their arts education at a huge rate. So much so that a couple of secretaries of education ago called this a civil rights issue. Right? Because the research, yeah, absolutely. It's tragic, but we're calling it out because the research is so demonstrable about the benefits to these students. So not only are they doing better in school, but Catterall actually studied, this cohort going into their 20s, even as young adults, more likely to have some college going, more likely to be in career-oriented jobs. So we've got a job to do to make sure every student is receiving a quality arts education. And you know what? It's not just to make the next generation of artists. That'll happen. But it's just like more creative, critical thinkers, people who are more engaged in our community, right? So this is another important way that arts are building healthier communities. Another question, actually, let me go back one on this because I want to talk one more thing. So we have an access and equity issue, right? Clearly with arts education. 76% of the American population says the arts are important to me personally, right? And so when we saw those high rates of participation and everything, and we've heard over the last 2 days all the benefits that come to us as an individual, that come to us as a community, when the arts are part of our lives, yet only 51% say everyone in my community has equal access to the arts. So people appreciate the arts. They also see that there's inequitable access. Same thing with arts education. 92% of the American public says it's important for students to receive an arts education. 53% say not enough opportunities for the kids and the students in our community. So that's a big issue that we've got to think about taking action on. One thing we also find is that the public will get behind government funding for all of this work. And so, about 60 to 70% say, yeah, federal, state government funding is important. But when we talk about really specific issues, arts education, you're up at now like 4 out of 5 people say, yes, it's appropriate for the government to fund these programs to address mental and health issues, to address and help returning service members and their families, reintegrate into society. So you can read more about this, but there's a lot we have to work with here. And this is then the takeaway. Now we got homework, right? So this is the audience participation piece, right? We got, MK is going to send us away. We've got to do something. He started the list even before I talked, but we've got to be champions, for arts funding, arts across our community, because the research, the evidence is just so clear, the benefits. So, but how do you do it, right? How do we be an advocate, and all those type of things? Because there's like whole libraries on lobbying and all that type of thing. I break it down to 3 questions. What's the message? Who gets the message? And who delivers the message? So the first one, what's the message? Boy, we've talked about a whole bunch of them today, right? Arts help us heal quicker. Arts improve education and academic performance. Good for the economy. And, we need a quiver full of case-making arrows. So your job, find a quiver that you love and fill it up with those case-making arrows about all the benefits to the arts in a community. And then, because that helps you with the second question, who gets the message? And that's where we do a little bit of our advanced research, you know? And so who are the decision makers, the funders? Maybe it's a CEO, maybe it's a budget committee of the city council or a board of trustees at the foundation. And what do they care about? So, you know, this might be the education congressperson. So get in there and start first talking about education. This person may care about mental health. You know, there's members of Congress. That's their number one issue. So, you know, what do they care about? And lead with that. But of course, be ready to talk about all the different ways the arts benefit our community socially, educationally, economically. And last one, who delivers the message? Sometimes I think this is the most important one. You know, in DC, American City Arts, they bring me up to the Hill and to do, you know, briefings for members of Congress or their staff. I mean, by now, they see me coming a mile away, right? You know, guys kind of cover up their wallets, ladies lock their purse in a drawer, because they know what I'm there to do. But if I can bring an artist, a school superintendent, a hospital CEO, a military officer, to talk about how the arts you know, improve their work, their community, totally changes the conversation. I'll give you an example. We had the mayor of Mesa, Arizona, a couple of years ago on a panel for us, and he was talking about, you know, it was budget hearing night for the city council, and so it was me, you know, the mayor, and all the city council, and 60 people lined up to do their 3 minutes about arts funding, right? But he said, I noticed that the chief of police was there that evening, which in itself wasn't unusual for a city council meeting. He said, but he was in full chief of police regalia, hat, tie, medals. And he said, that was different. And after everyone else had gone up and done their 3 minutes, the chief of police asked for 3 minutes. And he got up and said, you know, if you got to take a cut out of the arts budget, I'd rather you just took it out of my public safety budget. Because when they do their job well, it makes my job easier. Can you imagine if we had 1,000 police chiefs on that message, right? So, you know, who delivers the message? We've all got boards of directors. We've all got neighbors, you know. Who can we bring along to help tell the story? And then lastly, I've got a golden rule for advocacy. No numbers without a story. No stories without a number. We're the arts, right? We're full of stories, you know, about how our own lives may have been touched, or, you know, somebody's, you know, a child's life in our program was transformed, or, you know, whatever. And then follow that up with the numbers. That's how you create a legislative visit that's not soon forgotten. So let me start to wrap up here and turn it back to MK with this picture, which is from Paris in 1913. Bad news at the Louvre. The Mona Lisa was stolen. It took them 2 years to get it back. But in the 2 years that the Mona Lisa was missing, more people went to see where it had been hanging. Yeah, you know where this is going. Than saw the painting itself in the previous 14 years. It's so easy for everybody to take our work for granted, to assume our artists, our culture bearers, our arts organizations, our arts therapists, our champions for the arts are always going to be there. We have got to be relentless messengers about the benefits of the arts. I mean, our communities, our future just depends on it. Everything you do to advance the arts is important, and you're important for doing it. Thank you very much.